All right. Put mine right there.
Okay, so I'm gonna,
Hey, I'm taller.
that's right. She made it for me and you. And then after you speak, she's gonna move it.
Others might want to be tall.
Great. Well, aloha everyone. Thank you so much. We have folks up from the rafters and we have a nice audience here and we have a group online, and I just really wanted to thank all of you for coming here on relatively short notice. So I'm Dr. Chien-Wen Tseng. I'm the Associate Dean for Academic Affairs. I'm also a colleague of Chien-Wen in the Department of Family Medicine and Community Health. And just really so words can't describe what this means for us and for Chien-Wen. So I wanted to welcome our many special guests, including Lieutenant Governor Josh Green, Senator Jared Keo'olole, UH President David Lassner, UH Manoa Provost Michael Bruno. We have many others from the PHREI Board, from HMSA, Hawaii Pacific Health, and the Queen's Health System. And also to welcome to Chien-Wen's Hanai mom, Mrs. Emily Wu. So again, we're so pleased that you all could join us on such short notice, because we were only notified officially on Thursday that Chien-Wen was indeed elected to the National Academy of Medicine. And so since so many of her colleagues and mentees are busy seeing patients, we're streaming it and it'll be recorded, and we'll be sharing the link after we're done. But before we get started with the presentations that will help explain the significance of this morning's announcement, I'd like to read a letter from our director, Dr. Elizabeth Char, who couldn't be here today. Dear Dr. Tseng, congratulations on your election to the National Academy of Medicine. National Academy members are selected for major contributions to the advancement of the medical sciences, healthcare, and public health. Your election as one of just 100 members in the class of 2022 reflects the depth of your professional achievement and commitment to serving our community. As noted in your National Academy application, family medicine physicians serve patients from birth to death, and in doing so, gain a holistic and unique understanding of the issues that Hawaii residents face in accessing quality care. This understanding is reflected in your commitment to serve your patients, the medical students and residents that you teach, and the community at large. Your work to improve medication access and affordability extends from research and collecting data to practical tools that help Hawaii residents. Your development of a website to centrally locate the costs of prescriptions teaches our physician colleagues about cost-effective prescribing and contributes to lowering healthcare expenses for Hawaii residents. We know that now more than ever, it is critical that health policy and practices are set by experts. The National Academy serves as a thought leader in our field, and I am proud that your voice will represent our community on this prestigious body. Sincerely, Elizabeth A. Char, Director of Health. So at this time, I'd like to call upon Dean Jerris Hedges, who himself was elected to the National Academy of Medicine in 2000.
Well, I feel tall. I probably need that, but I'm going to take it away. So thank you all for being here. I consider today, October 17th, as Chien-Wen Tseng Day, and it should go down in history as Chien-Wen Tseng Day. And I believe that appointment to National Academy of Medicine is really the medical equivalent to winning the Academy Award or the Nobel Prize for those who are doing clinical research in medicine. An election into the National Academy of Medicine represents national recognition for your contributions to a field of medicine. When I came as dean, there was an opening for an HMSA endowed chair position. It had been requested but unfilled by Dean Cadman. So I looked about and tried to determine who was doing health services research. And everyone said, Chien-Wen Tseng. She's the person who is really achieving a lot in that field and already had some publications in JAMA and other high visibility journals. So I approached her and she fortunately said yes. But then I had to talk to the then head of HMSA who said, we really want someone more visible nationally. And I said, she will be, don't worry. And then I had to talk to the chair of family medicine, who said, but we need her to do clinical shifts. And I said, well, she will do clinical shifts, but we have to give her a little time to do her research. So that was working with Neil Palafox, and he was very gracious in working out a wonderful arrangement for her, with support from the HMSA funds to help with her research. And that was continued on by Dr. Chip Hickson, who will speak from the vantage of the current chair of family medicine and community health. But I was just really thrilled to be able to appoint her to that position, and she's done some really wonderful things. And then, approximately 5 years ago, I had the opportunity as a member of the National Academy to nominate someone for the U.S. Preventive Services Task Force. And I said, who else but Chien-Wen Tseng? She's doing all this great health services research. So you should all be aware that when the Affordable Care Act was passed, there's a provision that Centers for Medicaid and Medicare Services will only approve funding to those diagnostics, therapeutics, and health processes that are favorably reviewed by this task force. Very elite task force. At the time, I believe there were only 14 members. Now there are 16 members. And at the time that Chien-Wen was appointed, she was the only practicing physician. There are some other physicians, but they're all administrative, because it was a huge task to review all of these reports and make recommendations, consensus recommendations. So it was very unique, first to have someone from Hawaii in that post, and then to have someone who was able to continue her clinical practice and provide the clinical insight into those difficult decisions being made by the task force. So just a quick word about how one gets elected. Obviously, there are nominations, but the nominations only come from current members, and they're by discipline. So even though I was a member, I could not nominate Chien-Wen. It had to come from another family physician. And because of her recognition throughout the nation on the U.S. Preventive Task Force, she was able to garner support from other institutions. And then she had to be ranked by her peers. And there's some 20 highly recognized family physicians each year that are put forward. So she, of course, was at the top of that list. She then went into a section which had 3 disciplines, and approximately 50 to 55 total each year are put forward. Again, she came out near the very top of that. And then you go for election amongst the entire membership. And this year, I'm really not supposed to reveal this inside information, but just for your knowledge, out of 38 physicians who were elected, she was number 18. So very, very highly regarded nationally for her work. So excellent. And so I just, can't say enough about what she's contributed. So we got a lot of other people who are going to do that. But I just want to say what she brings to our school and what she brings as a role model to Hawaii are very important to us. And so with that, I am just unbelievably pleased to recognize this as Dr. Chien-Wen Tseng Day.
Thank you. And now we call upon Lieutenant Governor Josh Green for some special remarks.
Aloha, everyone. So first off, let's just put this in perspective for Chien-Wen. An extraordinary doctor, an extraordinary human being. The dean already took the cliche we like to use, which is it's like the Academy Award of physicians. For those who want another metaphor, it's like being in Top Gun. where she is the best of the best. She is now the Iceman of physicians from Hawaii, or Maverick. She's a star. She grew up here from Punahou, got her undergraduate degrees as an engineer in math, and had that kind of intellectual rigor before going on to medicine. And we were lucky. We're lucky as a community that Dr. Tseng changed her focus to medicine, as very few people do, and completed her medical degree then at UCLA, and then her family medicine training at the University of Washington. It's really one of the best programs in the country. So a star was born long ago. She has a public health degree, a Robert Wood Johnson clinical scholar. Just it goes on and on. So as Dean pointed out, we were just plain lucky that she was recruited home to JABSOM, where her father was a faculty member in psychiatry. So sometimes the apple doesn't always fall too far from the tree, but we're grateful that he helped bring you back. We at the Department of Family Medicine in our state are proud of the people that come through here. There are extraordinary people in your midst. There's also, well, I think even our dear Neil Palafox is off in Geneva today. He's working at a high level. It just is a testament to what Dean and team have created, and then this award for you. It's incredible. And that's why we're just so grateful to see JABSOM thriving, and why we encourage the university to continue to wrap its arms around JABSOM and to find ways to make this campus, which has these incredible scholars here in our midst, thrive. You guys up there are part of this experience, and you support her research and this team. So we are excited. We're amazed at your impact, Doc. I think also people might not know the breadth of the impact. As Dean said, very important to health policy. Well, the policy that Chien-Wen worked on affected 40 million Medicare patients. Imagine that across our country. So again, it takes a Top Gun doctor to make that kind of impact. And so we are extremely proud of you. We're grateful for these contributions that rise up amongst others. We're particularly thankful to you for making JABSOM look so good. And as some of the others who become older and have gravitas become replaced by the younger, brilliant scholars, we just know that there's continuity. And so again, it's one of the highest honors for clinician scholars. You couldn't possibly get in here if you weren't so spectacular. So on behalf of me and Jamie and all the state of Hawaii, just congratulations. And I hope that this is a wonderful day for your extended Hanai family, because I know you're so proud of her, just like we are. So congratulations, and thank you for everything you've given to Hawaii and America. And here is a proclamation that basically says, you are great.
Great, thank you. And now we'd like to call upon Senator Jared Keohokalole to please come and say a few words.
Thank you. Thanks for getting rid of the stool, Jerris. I'm really happy to be with you all as well. Appreciative to be a part of this really significant event. The last time I was here, we were announcing some really significant appropriations for medical residency and loan repayment for doctors who are just coming out of JABSOM. And I remember looking at the John A. Burns School of Medicine sign and thinking about Governor Burns and how the vision was to grow our own doctors, grow our own healthcare professionals, so that we didn't have to rely on outside help to maintain a robust system. And so this is really nice to be a part of this, coming back, because this, for me, reflects the comprehensiveness of the school. We also have someone who's homegrown, that's reaching the apex, the best of the best. Thank you. As a lawyer among doctors, sometimes I get a little intimidated about the nomenclature, so Iceman, got it. Great job, Lieutenant Governor, for pointing that out. And so, like he said, I'm very proud to be a part of this. We're all extremely proud of you for achieving this really significant a milestone, and then being a part of such a broader conversation that, as a state legislator, year after year, reviewing health policy and how exactly we make things like prevention and screening and just access for our community, how we make it all work given the year-to-year uncertainty in our economy and budgets and all of that. The fact that we have somebody from Hawaii that's up there at the big table that can provide perspective is really, really amazing and important. It made me realize, so I was thinking about this on the way over, part of why it's important are things like this. In 2018, when the volcano erupted in Puna on the Big Island, my wife and I, who used to live in New York, we did for a couple of years during school, we immediately started getting messages from friends on the East Coast going, "Are you okay? Do you have to evacuate? I hope you're all right, your family's okay." And we constantly had to explain to them, as many of you probably did, that's a different island. We don't really care on Oahu, I'm stuck in traffic. So, that might be a small thing, but when you're making decisions that impact tens of millions of consumers on this really high, on this really significant national body, those types of local issues that really matter over here are really important. One of my best friends moved to Hilo 2 years ago with his wife and his daughter, who was 2 and is now 4. We were just on the Big Island, and they don't have a PCP for her yet because they had trouble finding access, Luckily she's healthy and they haven't had any issues, but these are real issues that affect us in a really specific way in Hawaii. They're issues that we have to deal with every single year, and so often they are impacted really significantly by decisions made on the national level really, really far away. So it gives me comfort and confidence and assurance that hopefully they're going to do the right things up there, and if not, make a bunch of noise for us, please. It's worked for Maisie. I'm not recommending any specific behavior, but I do appreciate, and then finally, I appreciate your work specifically. That's why I mentioned preventive care and screening. The fact that you've done work, what I was reading about how, you've brought in transparency in pricing. And as someone who stands in the sock aisle at Walmart and Googles Amazon to figure out whether I can get a cheaper price by waiting a week to get it by mail, that stuff is really important, and again, it impacts people in rural communities, people who don't have access. And so I appreciate your work. I'm very proud that you're up there representing all of us. Thank you all for having me, and congratulations again.
Thank you, Senator. And now if we could call upon UH President David Lassner.
Thanks, Lee. So, if you could have waited another few months, I think that declaration, we could have made it Chien-Wen Day, but the LG can't do that unilaterally. Yeah. So, first, congratulations, proud mom. It's such a happy day. Michael's going to say more about the way we at our research university think about National Academy members, because unlike UC Berkeley, Stanford, we don't have that many of them. But we're growing them, and I want to come back to that point. What I want to say, though, also is that, and Jerris and Michael and I were actually just in a conversation before this with the deans, and one of the things I talked about, you will love this, Senator, is the importance of us making an impact on meeting the needs of the people of Hawaii. And I think this recognition is really a great example of where we're not just doing superb academic research, but research that matters. I don't want to rehash everything that Libby and Jared have said, but this is 2 decades of work that Jerris just highlighted. making really seminal contributions around medication access for, a quarter of Americans who can't afford their prescriptions. That's a current estimate. Her work on Medicare Part D drug benefits that has impacted tens and tens of millions of people directly, improving quality of life. Service on the U.S. Preventive Services Task Force, 62 sets of guidelines that she co-authored that help define modern preventative care, and herself a family physician bringing that expertise and experience to the task force really epitomizes the way we need more practicing physicians who are redesigning our healthcare system. Sorry, not just politicians and lawyers. But we are, I think, for me, especially proud. Jerris is our other active faculty member in the academy, and we had to hire him as an academy member. We didn't grow him. Someone else did that. But this is an example of where our university has really made the investment in one of our faculty members to provide those opportunities. Thank you, Jerris. This couldn't have happened without you also. And show that the people of Hawaii are the best. And in demonstrating that, we're also creating the opportunities for our faculty to bring our needs and our capabilities and our expertise to bear on national problems, challenges, and in so doing also serve all of the people of Hawaii. And that's what great research universities do as well. In addition, your work here in the medical school, which, thank you, Neil, for not letting you give that up entirely, in mentoring our faculty, our students, practicing physicians within the state of Hawaii is so important, and influencing the way our docs in Hawaii are practicing to improve the health care of their patients. So just mahalo for all you've done. Congratulations, and thanks for giving us this excuse to celebrate you, even if the LG couldn't deliver an official day in your name yet.
Great. And now, if we could have Provost Michael Bruno.
Aloha. I do want to say, as an engineer, I'm going to point out that now 100% of the National Academy of Medicine members from JABSOM also have degrees in engineering. So I don't know if everybody knows that, but now they do, everybody watching on this. So I want to speak on behalf of the faculty. All of the Manoa faculty, on their behalf, I offer my sincere congratulations and respect and appreciation for all that you've accomplished. So on their behalf and my behalf, congratulations. Manoa prides itself on our academic excellence, and on our, in particular, recent achievements in terms of growing enrollment, in terms of excellent graduation rates, and we just heard about that, and also research excellence. We continue to break records for the level of research, the quality of research, but faculty having membership, gaining membership into the National Academy is a very, very visible sign of that excellence. And as the President said, we don't have many. We are very proud of those that we have. And this just, I think many people might not recognize the impact that this has on the university and on all of our faculty. That recognition, of course, with the news that goes out, and people will hear about this, of course, but you gaining entry and having a seat at a new table, and alongside all those new and existing Academy members, you are carrying our name with you. You're carrying the university into those meetings, and it's an elevation of our reputation, and along with that, it affirms the excellence of what's going on this campus, and it strengthens that reputation that in turn helps every single one of our faculty. And so on their behalf, again, congratulations.
Thank you. And now I'd like to call upon our JABSOM Associate Dean for Research, Dr. Mariana Gershenson.
So I'm going to take the national angle. And I'm going to start out with a little bit about the history about the National Academy of Medicine, and then why Dr. Tseng is so meritorious for this award. So this is sort of the big picture view. So the Institute for Medicine was founded in 1970, and the National Academy of Medicine makes up one of the three academies. So there's one in sciences, one in engineering, and one in medicine in the US. And it operated in 1863. It's been a long time, and it was actually proposed by Abraham Lincoln. So, the National Academy of Medicines are a private nonprofit institution that work outside of the government to provide objective advice on matters of science, technology, and health. This is an honorific society for exceptional leaders. There are over 2,000 members, and as Dean Hedges said, they're elected by their peers in recognitions for their outstanding scientific achievement. Now, they volunteer and they continue to advance the mission of the National Academies. Now, you've got to be a distinguished professional in your field in medicine and health. You have to continue being involved in healthcare, prevention of disease, education, and research. And you've got to be willing to be part of this academy. So it's quite, it's a lot of work. But the mission of the academy is to improve the health of advancing science, accelerating health equity, and providing independent, authoritative, and trusted advice nationally and globally. And the vision is a healthier future for everyone. Now, that's where you fit in, Dr. Tseng. I cannot say that enough. She is a tenured full professor in the Department of Medicine. She is also their director of research. And she actually, came to us both via JABSOM and via the Veterans Administration Pacific Health Research and Education Institute. And she's been here for 20 years. You have provided outstanding mentorship for our students and our faculty. You have grown more of her investigators here. And her expertise truly is health service research addressing preventative care, quality of care, and cost of care. So I want to pull back for a minute and really think big picture. We spend $4.1 trillion, these are the 2020 numbers, on healthcare, 20% of our GDP. And if we look in Hawaii, we've got 50,000 residents who do not have health insurance. 1 in 3 Americans can't afford to pay their medical bills. So what you do is so important. As Dean Hedges said, she's been the HMSA chair since 2009. You served from 2016 to 2021 on the U.S. Preventive Task Force and serve as a consultant now. Her expertise is in one of my personal areas, which is diabetes care, and also drug costs and Medicare Part D benefits. Now, I really want to talk about some of her other accolades. They told you were a maverick. To me, you are a rock star. She is every year the NIH gives out 35,000 R01 grants. There's only 35,000 people in the United States, approximately, who have these grants. These are truly the people who are the leaders in science. And you've had one of these, so it's a major achievement. And it's not what most of us think of when you think of an R01. Most of us think, oh, it's probably basic science or translational research. But she actually did get a National Institute of Diabetes, Digestive and Kidney Disease grant to study reducing the cost of medications for individuals with diabetes via Blue Cross Blue Shield, looking at the prescription guidelines. So you've published 125 peer-reviewed papers. I think around 45 to 50 of them are in JAMA, and then a lot of them are in Diabetes Cares. These are journals that they accept 4% of the publications. Most journals accept 50% of the papers. So it's quite, most of your work, especially your recent publications, have been in things like colorectal cancer, lung cancer, prediabetes, and diabetes. And what was mentioned before is very important. That task force, which there are only 16 people who serve on that task force across the United States, determines what Medicaid, Medicare, and what most insurances are going to pay for. That is not minor if you think about it. And it's 16 individuals that do this. So, I want to conclude with what is Dr. Tseng's philosophy. It's to do research that really makes a difference in people. And she's a physician scientist, and her research is guided with, will this help the patients I serve? Is it needed? Is it sustainable, affordable, and can it be implemented in clinical practice, business, or policy? And her goal is something that we all care about, which is to eliminate health disparities and provide quality care and health for all. So congratulations.
Wonderful. And now we could call the President and CEO of HMSA, Dr. Mark Mugishi.
Aloha, everyone. Congratulations. HMSA has made a lot of investments into medical education. It's core to what our mission is and what our purpose is, obviously. But I just want to take a little bit of time to explain why this one is so meaningful to us. So our mission, HMSA's mission, is to improve the lives of our members and the health of Hawaii. So the way you do that is tactically you address what's called the quadruple aim. So you focus on the whole person experience, the population health, the health of your population, delivering all of that in an affordable way, and then making sure it's equitable and managed across the whole state or population. And the work that you've done is just spot on. It's just on point to all of that. And that's exactly what's going to make us get to our goals, and that's why it's so important. When you address that quadruple aim, you're saying, let's move upstream. Let's not worry about things when it's too late, when you have to retroactively deal with the care. You want to proactively get up and do prevention. You want to ask people what matters to you, not what's the matter with you. You want to be able to say, and we're going to do all of this in a cost-effective way that's going to make our entire society better because we've done it that way, and so we can invest money in infrastructure and housing and education. It's not all in the treatment of diseases that could have been prevented. And when I think about the work that you've done, this is why we invest money into the development of physicians, because we want every physician to think like that and develop the skill set that they can transform the way we think about health in our country and in our state. So, thank you for everything you've done. We're so proud to have been a small part of everything you've accomplished. Mahalo.
Thank you. And next, we'll have Ms. Vicky Shamba, who's the Executive Director of the Pacific Health Research and Education Institute.
Aloha. And Pacific Health Research and Education Institute is a nonprofit in the community, formerly known as Pacific Health Research Institute when Chien-Wen first came 20 years ago. So we were very happy at that time to work with JABSOM in recruiting Chien-Wen back home to Honolulu. And both of us valuing the importance of having physician investigators who are researchers as well as practicing clinicians. So Chien-Wen made her research home with us and spent part of the time at PHRI and became an investigator on one of our federally funded studies, which was TRIAD, Translating Research into Action on Diabetes, and that was 8 years. She was an investigator on that study. We were one of 5 sites throughout the U.S., and so she had a network of investigators that she was working with, publishing, doing new studies with. And it was a great opportunity. From there, she went on and developed her first R01 that was mentioned, and that was reducing cost-related medication non-adherence on people with diabetes. So she's had a long career, still going, still doing lots of activities and new things, never being afraid to try something new. That's good, Chien-Wen. So we just want to say we are so happy for you and so very proud of you. Thank you.
All right. And Dr. Chip Hickson, who is our, where are you? There you are. Who's our chair of the Department of Family Medicine and Community Health.
Have some props. We're going to have a book club later. So thanks to everyone who's here in person and those who are joining us virtually. Typically it takes a tsunami or natural disaster, perhaps a COVID pandemic, to gather this many health leaders in one room at the same time. So, pretty amazing. We actually don't have a disaster today, but a little more of a celebration. So that's the good news. I was really pleased to see Josh Green here with us earlier. Apparently this isn't a very busy week for him, and he has lots of time to come out for events like this. So I've been most fortunate to call Chien-Wen a colleague for the past 18 or so years that I've been here. She had joined the department shortly before I came, and everyone today has said all these nice accolades and so on, but I've really worked in the trenches with her, so I'm going to be able to balance things out a little bit, I hope, before we give her a chance to speak. So when we got word that there was something going on with the National Academy of Medicine, it might have to do with Hawaii, and then Jerris said it might have to do with the Family Medicine Department, it sort of perked my ears up a little bit, and so I asked Jerris some questions about what was it like to be named to the National Academy, and what was that experience? And, so Jerris, in his kind of gentle way, said, well, I flew to Washington, and they had the ceremony and so on, and then there was this reception, and they set up in the hotel or whatever it was, and the banquet room. They have those tables about this high, and they're covered with a white tablecloth, and you stand next to it with your hors d'oeuvre or what have you. And so Jerris went in, and he saw there's an older guy at one of these tables sort of by himself. So he went over, and Jerris said, gee, I was kind of new to the academy, didn't know anybody. So I went over and introduced myself, and I said, so, what was it that, that you did to get here? And he said, well, I'm a radiologist. Jerris said, oh, I'm interested in that. What kind of, radiology research and so on did you do? And he said, well, I'm interested in imaging and so on. And Jerris said, imaging? Well, what kind of imaging did you work on? I'm an engineer, I'm interested in that stuff. He said, I invented the CT scanner. So, true story, and Jerris told me I could repeat it here today. But this just gives you an idea of the sort of people that get inducted into the National Academy, and I think that is just incredible. So who is this Chien-Wen Tseng that we've all been talking about this afternoon? I hope I can just bring a little bit of depth to it. So there's a book called People and Cultures of Hawaii, a psychocultural profile. This was a University of Hawaiʻi press book. and this was published back in 1980. And one of the authors is Wen Tseng. This is Chien-Wen's dad. And Chien-Wen's parents were both psychiatrists and really very well known in the community and really carved out the idea of cultural psychiatry. And I think that is remarkable. And I know he's not here with us today and your mom, but I wanted to bring this book because I know they would be very, very proud of you. And I just wonder what it was like to have dinner at Chien-Wen's dinner table with two parents who are psychiatrists. And Chien-Wen would say, well, it took two of them to raise me, so two psychiatrists. So in football, there's something called the triple threat. You probably all know about this, right? You gotta be able to pass, and you gotta be able to block and tackle, and you gotta be able to run. That's the triple threat in football. Well, in academics and in medicine, we talk about the triple threat. And that's someone who's the consummate clinician. When you can't figure out what's going on with that patient, the case is too hard, there's someone that you turn to, and you say, can you help me with this case? So the consummate clinician. The teacher who has that something special and can really mentor others. And the researcher who's really doing creative and pathfinding work. And finally, the person who can work on the systems level, and that's the advocacy and the policy and changing things and making things matter. And I would just say that Chien-Wen is somebody who can run and block and tackle. So she's got all of these pieces. You've heard a lot about it from the folks who spoke before me, and I won't reiterate all of them, but you've made remarkable strides in all of these areas. And what really is so incredible is that most people who are working on the national level in the way she is have left patients behind long ago. And not Chien-Wen. She still rounds in the hospital with the rest of us. She teaches the residents. She shows up in the clinic every week to supervise the work that's going on there. And that's truly remarkable. Finally, in preparing these comments, I went to our clinic manager. It's just salt-of-the-earth, wonderful person who's worked with Chien-Wen for at least 20 years and knows everything that's going on. Whenever you wonder, you know, what's going on with the faculty or in the office, this is the person that you go to and say, what's going on? And so I said, you know, if you were going to make some comments about Chien-Wen, what would you say? You've known her for some time. And she said, you know, for all of the staff, we know Chien-Wen is really bright. And we know that she goes off to these big, important meetings in Washington. But there's something else we know. And that's that we know that she always checks in with us and she cares about us and she wonders if we're okay, particularly during COVID. And Chien-Wen is always the first to show up at somebody's house with chicken soup or dinner or a gift bag or whatever, making sure that they're okay. So this is the Chien-Wen that we celebrate, not just grand researcher over there, but just an incredible human being. So I want to make sure that that comes across as we visit today. So we're all very proud of you. I have some of my family medicine colleagues over here, folks that you have mentored and worked with over the years. And I just want to say that we did not need the National Academy of Medicine to tell us that you were special. We already knew that. So with that, if I could introduce Dr. Tseng, she's going to say a few. Oh, there you are.
No.
There you are.
It's your turn now.
First of all, it is completely amazing to be here. I am still absolutely stunned. Thank you for fans. And thank you to everybody for explaining to my Hanai mom and my two amazing friends what I've been doing for the last 20 years. The fact that it was explained by, you know, the president, the provost, the dean, a senator, the director of research, and the incredibly amazing people at PHRI and the HMSA and my department chair makes it believable. So, joining AMN is an incredible honor. I thought I would say a little bit with my 5 minutes about what the journey has been like on my end and what I want to see after this. I left Hawaii at age 18. By the time I came back at age 36, I had 5 degrees. I completed a 2-year competitive national health fellowship awarded to only 30 physicians nationally each year. I was highly trained. And honestly, at this time, at this point in my life, it was time to get a job. So, why did I come back to Hawaii? I came back for one reason, and that was to serve. And it was to serve my community that I grew up in. So the question is really, how was I able to do this and succeed? And it was really because of UH, because of PHREI and my department and JABSOM. With these people, I was given a position that was a joint position between JABSOM and PHREI. I was given, as Vicki mentioned, a position on an existing NIH CDC multi-million-dollar national study on diabetes quality of care at multiple sites nationally, including Hawaii. I was given access to HMSA data at that time to look at quality of care in Hawaii. This was really a dream come true. I had mentors, research networkers. All of this I could leverage to publish, to get the grants, to actually work on the projects that could actually make a difference to the people that I care about. So this is my ask number 1. That we continue to have these collaborations to bring back talent to our community. That we either keep people here because of education and work opportunities, or we bring them back after they train elsewhere, and that we continue to recruit people to Hawaii, nationally and internationally, who may not have grown up here, but can serve our people. This is how we build our future. Second, I want to talk a little bit about why I got into NAM. And it's really for work on access to care and quality of care. I have to say that it's really from the first day that a patient sat in front of me and said, I can't afford to pay for medications, that I really learned that health is a human right. That people who need care should get quality of care. And that is really the purpose of having a healthcare system in the first place. So for this, I've spent, as many people have mentioned, 20 years or 2 decades working every day, and every single day has been worth it. And I know that many people here share a similar view. So here's my ask number 2. We can't really talk about improving access to care, improving quality of care without data. For my work, I've interviewed over 1,000 patients, hundreds of physicians, analyzed health plan data for hundreds of thousands of individuals, worked on national databases for over 4,000 Medicare drug benefits covering close to 50 million people. I spent 5 years serving on the U.S. Preventive Services Task Force, creating those 60 to 80 guidelines that really are the gold standards of primary preventive care in the U.S. and internationally. It is all about evidence and all about data. I cannot tell you how many times I have sat somewhere wishing that we had this data for all of the state of Hawaii. That we had this real time so that we could improve health. So I ask for us to keep removing obstacles to care, whether it be financial, geographic, lack of technology, misinformation, systemic racism, or issues of LGBTQ equality. And for us to do so by looking at healthcare data in real time, to look at something as simple as in which communities are the teenagers taking up vaping, because that's how we're going to prevent that next epidemic of lung cancer, stroke, heart attacks, and all those diseases that we know smoking and vaping can cause. Who gets care? Who needs care? Who provides the care? How is that quality of care we're providing? And also, just as importantly, the cost of care. Because it has to be affordable, not for the person, not for you and I who get the care, but also those taxpayers and as insurers who actually pays for it. Third of all, I wanted to say, how did I have time to do all of this? On top of being a clinician, on top of working at the hospital, on top of seeing patients, it really has been the community, the faculty that I work with, the staff who have protected my time, my department chairs, Neil Palafox to begin with, Chip now, who have Dean Hedges, who every single step along the way has protected my time to do what I love and to do what makes a difference. It has also been, I really have to acknowledge, the HMSA Chair in Health Services and Quality Research. It protected time for me to do a statewide website for physicians to look at which drugs are covered and which are affordable for patients. It covered my analyst time for all the work I've done on Medicare Part D analyses. It's let me enter junior faculty, OBGYN, pediatrics, public health, College of Pharmacy. I could go on and on. So thank you. Thank you for everybody who's been part of my lives. Thank you to my Hanai mom for being here. Thank you to my incredible friends. Thank you to my kids who learned at a young age how to make instant ramen and macaroni and cheese. So every one of you has been there for me. Lastly, I want to say going forward, being part of NAM is really just the next step. As people have mentioned, this year along with the 100 new members includes the Deputy Administrator for Medicare who helped design the Affordable Care Act, the Chief Scientist at the FDA, the NIH Director of National Institute on Drug Abuse, the CEO of the Vaccine Alliance and co-establisher of COVAX, which distribute over 1 billion COVID vaccines in developed countries. Starting next year, however, I'm going to be at the table with these people, along with Dean Hedges. And I'm going to say, what we make up, what we don't have in numbers, we make up for in quality. This year, there are only 2 family physicians out of the 100 people that have been selected. Only 1 comes from the US. So I will be there to represent family medicine, to represent preventive care. Very clearly, I'm also there to represent Hawaii. Our diversity, our culture, the way we take care of each other is so key when I'm at those tables and talking with people. So just wanted to say, for this, I ask for your support going forward. I thank you for your support in the past. So, mahalo, everyone.
Thank you. And thus concludes our official speaking ceremony. Please join me in standing and giving Dr. Chien-Wen Tseng. So thank you, everyone. If you want to grab some photos on this very auspicious occasion, and I know many of you are so busy, so thank you again for taking the time and just for celebrating you.